Very good afternoon and welcome to this official launch of the new European Climate and Health Observatory, which the EPC is organizing in cooperation with the European Commission and European Environment Agency. I'm Annika Hedberg, Head of Sustainable Prosperity for Europe Programme at European Policy Centre, EPC, and will be moderating today's discussion, which is entitled Keeping Healthy in a Changing Climate. The unfortunate reality is that the climate crisis is already having multiple impacts on our societies and economies. The extreme weather events, heat waves, droughts, wildfires, floods that we're experiencing across Europe come with an economic cost. They come with a cost for the environment and people's lives and well-being. While we need to do all in our power to reduce greenhouse gas emissions and thus reduce related costs for the economy and society, we also need to take more efforts to adapt to climate change and become more climate resilient. For this aim, the European Commission published a new climate adaptation strategy last week on 24th of February. The strategy is very comprehensive, and it recognizes that adapting to climate change requires understanding linkages and taking measures across sectors. One of these cross-sectoral areas is climate and health. And one of the first concrete deliverables of the strategy is the European Climate and Health Observatory, which aims to anticipate and minimize the health threats caused by climate change. The observatory has been a joint initiative by DG CLIMA and DG SANTE in European Commission and European Environment Agency that is now managing the portal. And as we'll hear today, the observatory wouldn't be what it is without the input from several other organizations that have contributed to its development. Today's discussion is divided in two parts. We'll start with reflections on the policy context and presentation of the European Climate and Health Observatory. And after these opening remarks, we'll move to a panel discussion. And by the end, we hope that you'll have a good understanding of the interlinkages between climate change and health, as well as the goals of the observatory and the tools it provides. And we hope that today's discussion serves as the first opportunity to get the discussion going on how the observatory can provide value for different users in the future. As we hope to hear also from you during the next 2 hours, we'll take some questions from the audience after the opening remarks, as well as after the panelists have spoken. If you're interested to ask questions, you can do this either by clicking on the hand icon if you wish to speak, or alternatively, you can use the space provided to ask short, and I would like to stress short written questions. Let's start with the opening remarks and with the first part of our event today. We'll be looking at the policy context and we'll present the observatory. And we're extremely delighted to be joined by Mauro Petriccione, Director General at the Directorate General for Climate Action, known as DG CLIMA, at the European Commission, Pierre Delsaux, Deputy Director General at the Directorate General for Health and Food Safety, DG SANTE, at the European Commission, as well as Hans Bruyninckx, Executive Director at the European Environment Agency. Welcome. Starting with Mr. Petriccione, can you tell us about the state of play with climate change and EU's climate policy, including the main elements that are included in the new climate adaptation strategy? Thank you. The floor is yours.
Thank you very much, Annika, and good afternoon, everybody. Very happy to be with you today and to participate in the launch of an initiative which has taken my team and myself quite a bit of time to set it up together with many friends and partners. Today it is more frequent to talk about mitigation of climate change. We are engaged in a massive exercise in changing our policies, so to make sure that Europe makes its own contribution, its proper contribution to stopping climate change, and that we offer a working model for others on how you build a climate neutral, but at the same time, modern and prosperous economy and society. But we cannot forget that even in the best scenario, even in a scenario where by mid-century or shortly thereafter, we stop climate change from getting worse, and we start working to reverse things, that is still, that best case scenario is still decades away. In the meantime, climate change will continue. Hopefully not unabated, but it will continue. And we have to learn to live with it. We have to learn to adapt. The Commission has published last week the renewed adaptation strategy for the European Union. And as you pointed out, it has several strands, several very practical strands on how we manage an increasingly difficult relationship with a climate which is changing under our very feet. And one of the areas which people are not focusing on enough is the link with health. Of course, health is now under our eyes. The disaster that uncontrolled health pandemics can cause to our economy and our society is before our eyes. But climate change is capable of doing as badly as this pandemic, as this virus, in ways which are perhaps more subtle than the obvious way in which this pandemic is hitting us. Temperatures are on the rise. So is the difficulty for us to adapt to those higher temperatures. We are importing diseases which we didn't know. We're importing tropical diseases for which we as people are ill-equipped and for which our health system are not entirely equipped. We are having difficulties in coping with increased temperatures in summer, and this is beginning to affect not only the more vulnerable among us, but everybody. I think we should have learned from this pandemic the lesson that lack of preparedness can have very, very serious consequences. So one of the areas where we want to increase our ability to prepare, to manage, to foresee what may happen and equip ourselves for it is the relationship between the changing climate and health. I mentioned the effects of new diseases and of higher temperature, but climate change will impact our food production, it will impact our availability of water, it may multiply the threats that we have to handle. Now, the health profession, with all it has to on its plate now, has nevertheless started realizing the importance of this link and has started engaging seriously on climate and health. At the same time, we owe them greater assistance in preparedness. There is a lot which has been done around the world. There's a lot of knowledge, but the knowledge is scattered, not necessarily brought together in a coherent fashion. And we need more knowledge. We need better data. We need more surveillance. I think we need to pay attention to this in a more systematic fashion and bring the results of that knowledge to everybody, and in particular to our health profession, so that they are able to prepare themselves. And that encompasses everybody. It encompasses scientists, the health administrations, the doctors operating on the ground. I think we need to raise awareness and share knowledge and improve knowledge. And this, of course, is not something anybody can do on their own. So our first step was to team up with DG SANTE, first and foremost, with the European Environment Agency. But as you pointed out, this is a network that will be open to many participants across the world and will benefit all those participants and others. The key is that together we can be better prepared. We will have no miracle solutions, but as we have shown in the midst of this pandemic, if we do get together, if we share our knowledge, and if we share our effort, solutions can be developed extremely fast, even to seemingly intractable problems. And here we have more time to be prepared. We have more time for foresight, more time for learning. It would really be our fault if we didn't manage to prepare better than we are today to the health effects, among others, of climate change. And this is what this observatory is meant to start. It is not a miracle solution, does not provide the ultimate answer, but it is a start to a process which we have seen can be extremely effective, even in the face of very difficult circumstances, predicated on fundamental principle, working together to face a common threat. So I'm looking forward to the debate today. I think we have a number of colleagues who are very knowledgeable about this, but I'm looking forward even more to how this will develop in the months and years to come. So thank you for hosting this.
Thank you very much, Mr. Petriccione. And indeed, this is very much a joint effort. So we, as mentioned before, this has been both DG CLIMA together with DG SANTE, very much running it and making it come into reality. Mr. Pierre Delsaux, can you tell us a bit more about the EU health policy developments, as well as the rationale for aligning climate and health considerations from the perspective of DG SANTE? Thank you.
Thank you very much, Annika, and thank you very much, Mauro. Actually, you know, we really live in symbiosis with Mauro, because I could have said almost everything that he said. You know, it's really a joint effort and the common work, that's clear. So, first of all, the message that our environment is a priority and we need to act now is clear for everybody. Nobody will dispute it. And Mauro has explained what the Commission intends to do, but we have no time. We have to act now if we really want to deliver and make some changes in the future. Now, for the link with health, you know, you don't need to be an expert, and I'm not an expert, I'm not a doctor, but to see at the consequences of, you know, environment on health of everybody. Let me give you a very concrete example. Pollution, air pollution. You know, we see the consequences, asthma, you know, types of diseases which are there, which has been, you know, affected by the level of air pollution in Europe and elsewhere in the world. So already there, you have a clear link. If you look, I look at the question, and that's a very important, a relevant question, you know, the question of skin cancer. It's very likely that skin cancer will increase simply because of, you know, of the consequences of the changes in environment. And even more frightful to a certain extent, it has been also mentioned by Mauro, we have new diseases. And when I say new diseases, we have diseases which are not known in our countries, which are known in other parts of the world, which is one element. But we might have simply new diseases which we don't know, which will come to us, and for which we are not ready at all. And as you know, and if we have seen, and we are still living it, the consequences of this kind of pandemic is terrible for all of us, you know, in terms of life, of course, being lost, in terms of, you know, people going to the hospital, and of course, economy itself being affected. So we know for sure that environment will have consequences on our health. And so what we need really to do is to make sure that we try to the best possible to prevent this kind of consequences. So the approach that we want to take in DG SANTE, in DG Health, is really that one. You know, we talk about One Health. So we want to look at all the dimension, you know, human dimension, animals, because it's also important to monitor the situation of animals, because as you know, some of the diseases could come from animals, and of course, environment. That's really a global approach, inclusive approach, where the three dimensions are present: human, animal, and environment. But of course, if we really want to be prepared for the future, we need to know what's happening. And that's exactly the purpose of this observatory, is really to try to gather all the information which is available out there, which we can be regrouped into this platform, and to make sure that we get the knowledge which is needed to take the appropriate action in the future. And so that's why today is really important, because at the start of a process which will give us the tools to develop, you know, policies and actions in the future. And in this context, I would like to insist maybe on one key action that has been announced by the President von der Leyen, that we are going to implement very quickly, is the creation of a so-called HERA. HERA actually is, you know, it's an authority which will be created and which try to monitor the situation and try to anticipate possible diseases, possible crises which could happen. And that's something which we were missing in Europe, which, you know, probably would have helped us during the current crisis. But we want to avoid to be in a similar situation in the future. So we want to build HERA, and we want HERA to work, with all stakeholders to make sure that we know in advance which kind of diseases could appear on, in Europe and elsewhere, but certainly in Europe, and we are ready for those to fight those diseases. And from that point of view, the observatory is a key instrument and it's extremely important. So I really welcome the operation, the start of this observatory today. And one message is very clear, one main lesson of the crisis is by working together that we can achieve something. So we count on you, and we need to work as one team to deliver and to protect us for the future. Thank you very much.
Thank you very much, Mr. Delsaux. And as our last keynote, as part of this first part of the discussion, we have Mr. Bruyninckx from European Environment Agency, who will be presenting us the European Climate and Health Observatory. The floor is yours. Thank you.
Thank you, Annika, and it's a pleasure, of course, to be here today. And I'm in the lucky position that I can actually present and launch the observatory, which means that I'm also presenting the work of a lot of colleagues across the Commission, the European Environment Agency, and other partners. So I will share my screen, and then hopefully I can get started. Do you see my screen now? Can somebody confirm that you are seeing my screen? Okay.
We do see your screen.
Okay, that is great. So when we look at the European Climate and Health Observatory, as it has been framed by both Mauro and Pierre, I think it fits in a broader context where environment and climate factors and their impact on our health have been rising in importance politically and also in policy. And that is now matched by a growing knowledge context. And it is to bring that knowledge context together in the case of climate and health that the observatory will play a significant role. And I think we are not naive. We all know, especially in this audience, that climate is changing. It is changing quickly. It is having an impact on nearly everything in society, from our agriculture to biodiversity, to our energy systems, to choices in the housing and the mobility systems. So it would be a bit bizarre if it would not have an impact on our health and on our health systems. And it is specifically for that purpose that we focus the initiative of the Observatory on Climate and Health. Now, if you look at the map of Europe and you look at two scenarios, the low or medium emission scenario or the high emission scenario, and under business as usual, we would end up somewhere in between those two. And you just look at the temperature increases on an annual basis, a summer in the middle especially, you see that we will face very significant increases in temperature that will have an impact on all sorts of elements of our health. And this is just the temperature. Temperature is not the only thing that will change under climate change. So when we go to understanding the impact, we look at temperature issues, which have an impact on, for example, respiratory diseases and patients with respiratory diseases, but also people with cardiovascular disease, overall well-being, people's overall resilience in their health. If you look at the data that is matching temperatures in the summer to people passing away, especially in urban environments, there is a very high correlation between those two. But it's also winter spells, cold spells that could come through a disturbed climate, where we also have specific impacts on diseases and on people's well-being. There are, of course, the extreme events and hazards, which can flood or damage houses, that can not only have an impact on how healthy those houses will be after the disease, but also on mental health, on how people perceive risk, living in a risky environment, and of course the direct impact on vectors of disease. I would like to add a broader additional comment, and that is that we know that climate change also has an impact on biodiversity. And with changing biodiversity, we know that we are also increasing the probability of a disturbed ecosystem that is a fertile ground, maybe for some diseases to develop. If we think of the disturbances and the virological impacts, for example, and we've been living through the last year collectively, those are all concerns that are there. A last element on this slide is that, of course, the impacts and the vulnerability are not equally spread throughout society. There are populations that are more vulnerable to this, but there are also people that have less capacity to defend themselves or to protect themselves from these impacts and the risk factors that they live under. Now, if we look at the Health Observatory, it serves a number of purposes. And as you can see below, it is indeed fully integrated in the Climate Adapt platform, which we also host at the agency together with the colleagues of the Commission. It, of course, intends to bring together knowledge and knowledge developments. It intends to bring together a connection with policies that are out there. It brings together data, instruments, tools, projections, so that type of elements that can be used by policymakers, and it will make a link to the national context, because you can come with this type of knowledge at the European level and make a connection even to the global level, but at the end of the day, it will be the impact on what is done also in the member states or in cities that will improve the situation or not. I'm happy to say that, and it has been mentioned before, that the observatory is, of course, a collaboration between Commission partners with DG Environment, DG CLIMA and DG SANTE as the primary actors, but also a strong collaboration with the JRC on a number of elements and the European Environment Agency. But the observatory would not exist without a strong commitment in collaboration with other partners, and the World Health Organization Europe, the Lancet Countdown, tracking progress on health and climate change, of course, ECDC and EFSA as two partner agencies, and then the knowledge that we can bring from the Copernicus project, which is increasingly delivering not only petabytes of data, but usable information that can be integrated in knowledge systems to serve policymaking. If we look at the observatory as an open resource hub, it has a number of lemmas, which you can see at the top here, where we frame the policy context at the European level, the adaptation policy, the health policy, but also make a link with the World Health Organization's working group on health in climate change and country profiles. So you will get access to that. We also bring evidence from the health perspective, things like heat and health, vector-borne diseases. It has an indicator section that will guide you through projections and tools like map viewers, ECDC's Vibrio map viewer, a number of tools that allow you to go to those specific elements that you would like to focus on. And also, I think this is critical, and I think Pierre Delsaux mentioned this explicitly, health warning systems that allow us to take action in advance of worst impacts. Yeah. I'll give you a little flavor of what there is to be found. If we look at the Urban Adaptation Map Viewer, which has a number of elements in it, but you take the health focus, one of the interesting things to know is where, especially in an urban environment, which are prone to heat effects, urban heat island effects, where particularly vulnerable populations are living. Yeah, and this is a map where we look at people 75 years of age and above, and you can then make overlays with maps on climate change impacts, and you can get an idea of where the most vulnerable areas are. We also base on the platform. We make a link to data that comes from the partners, like the Lancet countdown, and this is a 4-year moving average of the millions of people above 65 that are exposed to heat hazards in a particular year. Well, you have seen my opening moving slide with the climate change average temperature in Europe. You can see that it follows almost the same curve. So you can track the high vulnerability. By the way, we are above 250 million in 2018. So these are not insignificant numbers. These are serious numbers. We also include information, for example, on diseases in Europe, which were rare or non-existent, and how they are spreading under conditions of climate change, and make projections like West Nile virus infections. And I emphasize the word is Nile. It's not Rhine. It's not West Rhine infections. It's West Nile infections. Yeah. So if you look at the spreading in the next 5 years and towards mid-century, I mean, these are serious impacts that connect diseases to, or the potential of disease to climate change elements. What is also there is a comprehensive catalog of resources with case studies, with the link to other information portals, with publications and reports, projects that emphasize on this. But it is obvious, and Mauro mentioned this explicitly, that this needs to grow. Yeah? This is a start, and the ambition is clear. It needs to grow. It needs to be completed with the best evidence, the best scientific knowledge, and with the best possible connection to the policymakers, because that's in the end where things matter. So it is a start, but definitely something that needs to grow and in which we need to invest collectively. And I mentioned policies a number of times, and I think this is critical. It is not enough to produce scientific knowledge or to have data. They do not speak for themselves. And what we intend to do also is to make an explicit connection to policymakers and those who can make use of this data. And we can connect this to policies at the global level, but also explicitly, of course, to the European level, where a number of the action plans, strategies, and legal frameworks are connected to the work here and the data. And at the national level, I think it will be important to not only stimulate action, make connections to what exists, but also to create an observatory that invites knowledge sharing, capacity building, and thus reaps the benefits from the investments in the various countries, because it is very uneven in Europe, the way in which countries respond to the link between climate change and health issues. And that is one of the goals of the observatory as well. I would like to thank you for the attention, but above all, I would like to thank the multiple partners that are gathered here today, and the colleagues that were involved for taking this initiative. I think it is a timely initiative. It's an important initiative. And now the challenge is to make it an initiative that really matters. And I think that intention was also voiced by Pierre Delsaux and by Mauro Petriccione, and we are committed to working with all the partners to do exactly that. Thank you.
Thank you so much for this overview, and it really does look like a very comprehensive tool for different stakeholders to utilize. And certainly there are a lot of knowledge gaps that need to be met, and it is great if there is a tool like the Observatory that can help to address some of these challenges and gaps that there still exist. If I may just, we have some minutes to take some questions, and I have seen that already our audience is very active and posing a number of questions there. I'll take a few from there, but I would also just want to start by asking, both from the perspective of DG CLIMA and DG SANTE, how do you see that the European Climate and Health Observatory can help you in your work? And if we start with Mr. Petriccione, be happy to hear your thoughts.
Thank you, Annika, and many thanks to Pierre and to Hans for the intervention and presentation. Look, as I said earlier, we have paid more attention to mitigation and to adaptation in the past. Not because adaptation wasn't important, but there was a sense that by stressing too much the need to adapt, we may give a convenient excuse to people not to do what we need to do to stop climate change. Now that has changed radically. I think Europe is fully committed to do its part to stop climate change and to help others. It's now time that we devote an increasing part of our attention to how we manage ourselves that process. And this kind of initiative is going to be precious. This is not the only knowledge initiative that we are taking in the field of adaptation. It's one of the newer ones, one of the most important, but we have learned over the year that there is a lot of knowledge out there on how to manage and how to cope. Bringing it together and developing further is the key. So we trust that this observatory will help us on the issue itself, the health, how we give a contribution to being to face the consequences, but also will help us develop further a method, a way of working together. I saw in the chat somebody was talking about the fact that medical data are not available to climate scientists. That's exactly the problem that we have. Data are there. Hans mentioned Copernicus. The problem we have Copernicus, and with Hans we've discussed that many times, is not having the data, it's understanding them, is making sense out of them. And the European agency is doing a fantastic job in that respect. It's, together with our JRC, is one of the big interpreter of this massive data. But we need more. We need more. We need more people involved. We need different perspectives. So climate and health is going to be an increasingly important part of our activity, but also it's a field in which we can learn techniques and the way of doing things, which we can use for many other things. We have to pay more attention than we have in the past to what we do with people. We are reasonably good at knowing what climate does to our economy, to our structure, to our enterprises. We're learning what it does to our infrastructure. People are more complex. They're more vulnerable. They're also more resilient. And learning more about what climate does to us as people is extremely important. And this is a tool which we really bank on.
Thank you so much. And Mr. Delsaux, from the perspective of DG SANTE, how can the observatory help you in your work?
I'm not sure I would say from the perspective of DG SANTE, because as Mauro has explained, you know, we have a global approach. It's not DG SANTE or DG Environment. We are all in the same boat and we need to tackle all the aspects of it. So that's the first element. Now, second element, as I said, data are fundamental, and I fully agree. You know, I used to be responsible for Copernicus and for Copernicus program, and I know a lot of data, but the real question is how to make use of those data, and that's really a priority to do it. Because with respect to health data, I need to tell you that we are also in a different situation, because actually we don't even have, you know, exchange of health data between health specialists. So in other words, what we are, it's one of the projects that we want to build in the field of health, is really to have a European health data space, because we don't have one of these. And that's important not only with respect to the environment, but also just basically to give enough information to develop new vaccines, new medication, new treatment, because we don't have this share of data. So developing a real data knowledge in the field of health and also communicating with environment is certainly something which is fundamental. And finally, as I said, I mean, we really need to build to be ready for the future crisis, because if there is one thing which is sure, we will have other crises in the future. We know that. So what we don't know is when it will be. And first of all, we are not yet out of the current crisis, let's be honest. But we know there will be other crises in the future. So the key to try to minimize, or even better to avoid those crises, future crises, is really knowledge and data. And that's why the observatory is so fundamental in this context. We need to have this data as soon as possible to try to be ready for the next crisis. Thank you very much.
Thank you so much. Thank you so much. And as mentioned, and as you've seen yourself as well, there are a number of questions coming in from the audience. I'll pick two. It was great that you already talked about the importance of data and the challenges that we have with sharing of data, including health data. But I'll pick on the two questions. We had a question from Masha Smirnova, who's asking that and to what extent will the observatory work on the nexus of wider determinants of health beyond climate? I think Mr. Bruyninckx already referred to that to some extent, but maybe it will be good to clarify that. And we also had a question from Iona Psalzi, that should climate change and environmental health be introduced into education curriculum, particularly in the medical training? And what are your thoughts on that? What could be the role for the EU, or should there be a role for the EU in also getting these understanding about these linkages in the education curriculum, for example, in the medical training, but also elsewhere? Mr. Bruyninckx?
Yes, thanks for the questions. I can be very clear. The European Environment Agency, with a number of partners, including the World Health Organization, the JRC, and other partners, we have a long-standing experience of connecting environment to health issues. The environmental health agenda has been important for us. We will make that connection for sure. We look at the burden of disease analyses that are made, and the role of environmental pollution in that, chemicals pollution, those elements. But increasingly, we also make the link, and I saw that appear in some of the questions also, with social issues, issues of distribution. In addition to that, we do not only look at where this is problematic, but also where this can be beneficial. We know that improving the natural environment and bringing it closer to where people live and giving them access to it and stimulating that access actually improves mental health, but also improves people's physical health. So it's an agenda that has multiple dimensions, and we intend to keep working on all of that. And I think it fits into a broader perspective of one planet, one health. That is important. It fits in a perspective of preventative healthcare, where avoiding pollution and knowing how to operate in the current context is actually preventing more and stronger impacts on our health. And so that is the type of work that we focus on. And we're embedded in a number of initiatives in Europe. Very briefly on the educational curriculum, yes, but it's a long-standing discussion. I worked at a university or universities for 25 years. And the connection in between environment and health issues has not been central to the education at the level of medical schools. And I think there is a need to make that a part of the curriculum, but I'm not a specialist in medical school curricula, but it's clear, and we hear that all the time, that there is very little attention to that, and also for preventative healthcare. The focus has been much more on making people that are already sick healthy again. So that is clearly a shift in attention. That would be my response to the questions.
Thank you so much. I also want to give a chance for Mr. Petriccione and Mr. Delsaux to respond. And in your final remarks, it would be great to hear also if you have any wishes, hopes, expectations going forward, messages that you want to give to the users of the observatory, we'll be happy to hear from you. Mr. Petriccione?
Thank you, Annika. Look, I said earlier, one of the things that we want from this is to learn a method, to learn a way of doing. This pandemic and the increased awareness of climate change are teaching us a very important lesson, that what the problem of somebody else doesn't stay somewhere else. That it's easy to talk about interconnectedness, but things like this pandemic, things like climate change, bring home the fact that interconnectedness is real, and it's not necessarily, it's not always a good thing. It means that there's no such thing as it's somebody else's problem. And this is a way to try and cope with that awareness. The educational angle will come with awareness that if you're a doctor, you have to start foreseeing what will happen to your patient by the time you're in mid-career. Not, the knowledge that you acquire as a professional today will not necessarily be relevant, not only at the end of your career. We're all used to the fact that over 20, 30, 40 years, our knowledge becomes obsolete. No, our knowledge can become obsolete within 5 years if we don't stay alert and jump. And I think we need also to have method which enables us to cope with this changing landscape. I don't think that we can have miracle solutions. There is no instrument that will give us perfect knowledge even in one field, but multiplying our ability to interact and multiplying the variety of our interactions is crucial to keep our mind capable of coping with these changes. And what we are doing nowadays on health and climate, what we've done on environment and health, what we're doing between climate change and biodiversity, they are all facets of the same jigsaw. How do we understand that it's not just in the adjacent cases that we have connections? We have connection on the other side of the picture. And we need to learn to recognize them. And the only way I know that helps us recognize is bringing people together, connecting them and making sure that they can work together. And that's why we launched this observatory as virtual. We deliberately did not want to start the discussion whether we needed another agency or another body, another physical presence. We wanted this to be virtual because we wanted to have the widest possible reach. Ideally, a planetary reach, but let's not be so ambitious at the very beginning. Thank you.
Thank you very much. And Mr. Delsaux?
I don't need to add a lot to what has been said because we are all in agreement, and that's very good, of course, at the start of such an initiative. Maybe to come back to your question, the point I would say, we need simply to increase knowledge of phenomena. So the more knowledge we get, the better we will be in the future. And the second message I would like to say, and coming back to the approach of health, of course, yes, doctors are there to cure. But one thing also, one lesson that we are learning, that prevention is key. And prevention is key in many aspects. If we talk about cancer, it's not only, it's important, of course, to treat cancer, but it's even better to take measures to avoid that we develop a cancer. If we talk, today is the days of obesity. It's very well to try to fight against obesity. The best way to do it is to make sure that we have a healthy food which avoid people to become to have this kind of phenomena. So prevention is becoming more and more important. And what we want to do with this observatory is exactly that, to give us a tool to understand what's happening, what are the links, and to make sure that we develop, to the extent it's possible, prevention with respect to the health dimension of climate change consequences. So we are all in agreement. And the best example and the best, things I would hope for this is basically that in 5 years' time, in 10 years' time, this will be a marvelous instrument which will be widely used. Maybe on a worldwide basis, to come back to Mauro example, maybe not yet now, but in the future, it will be an example for the rest of the world. Thank you very much.
Excellent. Thank you so much, gentlemen. Thank you for providing us the context and the basis for the second part of our discussion. I think we really have a great basis on which to build on. And so thank you very much for joining us. And I would suggest that we move to the second part of the event, when we'll talk more about the linkages between health and climate change, rationale for the observatory, its value for different users, the role of various partners in its development, as well as hopes and expectations for its future. Joining us in this discussion are experts from the partner organizations to the observatory, as well as future users. And we'll start with the presentation from Ian Hamilton, Executive Director from Lancet Countdown. So very warm welcome. And as Lancet Countdown has done extensive work on understanding the linkages between health and climate change, Ian, could you tell us more about your work and findings? Thank you.
Thank you, Annika, and thank you, everybody. A real pleasure to join. I have a few slides I'd like to share today, and so I'll do that now. But it's a real pleasure to be a part of this launch event and to focus on tracking the conditions and impacts that climate change have on health across Europe. The European Climate and Health Observatory is really going to be a critical tool in that monitoring and knowledge exchange in terms of this collective challenge that we face. I lead the Lancet Countdown on Health and Climate Change, which is an international collaboration established to provide an independent global monitoring system dedicated to tracking the emerging health profile of our changing climate. So a key priority for our effort is really presenting that evidence base on health and climate change to support governments in tackling these challenges. And so it's been a real pleasure in being able to work with the European Environment Agency and obviously the partners in doing so here with this observatory effort. And we've been able to draw on our strong partners from across Europe to contribute data to this effort and report on the evidence base and the policy opportunities as well that exist for Europe. So together with the European Environment Agency, we produced a report that looked at this evidence base and the current policy context of where Europe should focus in terms of addressing the risks that climate change poses to our health. So in this report that we've produced, and you can see an image of it here in the slides, it's a collaborative effort that we've pulled together, and it looks at three areas in terms of what we focused on. So looking one at the impacts of climate change on health in Europe with the evidence base that is being produced, looking at how climate change adaptation and health policy in Europe, and in particularly looking at what the actions are to date. But then finally, of course, is really where the policy opportunities lie in going forward and how we can collectively work together in knowledge exchange and developing tools so that health is a priority in climate change policies going forward, and that climate change, health policies are responsive to the changing climate. So what does our report find? Well, first, we describe the increasing and weather climate extremes across Europe. And as Hans mentioned in the presentation of the observatory initially, these are growing, and our risks in terms of the European population to these heat extremes due to aging is increasing. We also see a change in ecological condition that increases the capacity of infectious disease. And as mentioned, the idea that we are now being exposed to diseases that have not been common to our region. These are now being present as a result of the changing capacity of the environment to provide for those diseases as a transmission pathway. We also outline how the European Union is placing health narrative within the current pandemic response. And I think this is a really critical junction which we're facing in terms of a policy landscape and how we deal with health priorities, and in particular, what that means in terms of our response to climate change going forward. We outline how national adaptation plans recognize human health, though we need to better understand the effectiveness of solutions. And we state the importance of further involving health professionals. This is really a critical voice, as we've seen, in terms of our response to events that have an impact on our health, and in particular, those around the response to climate change need to be brought forward. And really, as I say, in launching this observatory, this really fulfills an objective that we have with the countdown, and we're so pleased to be able to support, is in developing knowledge exchange and tools for those who have an interest in seeing actions taken forward in this space. So I have a few illustrations really from the observatory, as Hans has already shown, but just to give a flavor or an outline of what these indicators that we're showing are being tracked. So this particular indicator, which is looking at heat vulnerability, as already mentioned, shows, and this is really quite a relevant issue, is that 7 out of 10 of the most affected countries to heat vulnerability going forward are in Europe. And as I say, this is partly to do with not only the change in environment that we're experiencing, but is also the change in population and their risks around heat exposure going forward. And then there's, of course, very clear concerns around how adaptive capacity in terms of how we minimize those risks. You know, what actions are we taking in terms of heat alerts, in terms of providing cooling in a sustainable way? These are going to be key priorities going forward. As we say, we've also seen this change in how the capacity and therefore the risk of infectious disease is increasing, particularly looking at vector-borne, mosquito, and the like, food and waterborne diseases. Now, in Europe, we have not been subject to a high risk of these types of diseases in the past, but this is changing as the environment is becoming more conducive to carrying capacity and allowing for those diseases to be embedded within the environment, and therefore exposing to a population that have not had a lot of experience with that. So there's also a critical question around how healthcare responses are better able to detect the changes that we may be seeing in terms of disease outcomes, and being able to track those and share particularly quickly where we see diseases emerging in particular regions that have the risk of being spread. In terms of the economic impacts as well, which we can't forget, the change in climate, and in particular the heat exposure, is going to affect how we work. And so what this indicator is also illustrating is that in looking at our ability to work outdoors in heat, and particularly looking at the agricultural sector and the construction sectors, we're going to be impacting on our economy and our livelihoods by having ultimately to address how it is that when we're working outdoors in extreme heat environments. And as that increases over time, the risk that we have in terms of the economic damages will also increase. And so just to, as I say, to give an illustration of some of the indicators that are being tracked, and there of course are many more that we're looking forward to supporting and seeing come forward within the observatory, is really critical. And so just to say a pathway, and this is where we worked with our colleagues at the EEA in outlining where it is that European policy has addressed health within climate change and adaptation strategies. You know, so we know at the national level, all EU member states have national adaptive strategies or plans in place, and many recognize the threat the climate plays on health. But we really want to concern ourselves now with how actions are being supported and where we'll know where effective solutions are going forward. This also means being able to work at that very local level, looking at that administrative level, where right now a lot of the spatial planning, urban design, and environmental departments need to work more closely now with public health professionals, being able to look at detection and attribution around outcomes that are being experienced today, and in particular the risks that are going forward. So we see, oh, pardon me, I think I may have skipped a slide. We see that there is a real need to embed health in climate policies and climate and health policies. These are synergistic actions that we can take together to address our future. And so really in developing an approach where we can share information and build an evidence base, and in particular, this is something where Europe has a real strength of being able to do this in a way that is bringing many voices to the table to focus on what it is that we need to be doing, how we could be better say detecting and contributing in terms of the evidence base, how to take actions. We also know that there is a need for us to put in place early warning systems to be able to share that information as quickly as possible. We also know that we can prepare and plan for these changes as we have better sensing environments. We're having better integrated data platforms, being able to share around how responses to emerging phenomena and extreme events and the change in climate as to what's effective, being able to provide a knowledge base where policymakers will be able to work with researchers and health professionals to be able to better develop a prepared strategy. And finally, of course, is the need for us to put in place plans that today meet the pandemic impacts and the economic recovery such that it's aligned to the Paris Agreement goals. So we need to be able to put in place a triple win strategy that focuses on reducing climate change-induced health shocks, offering cleaner air, healthier diets, and more livable cities, of course, and being able to ensure that our response in an economic platform is there to protect health and promote that economic sustainability that we so need going forward now. And so just say thank you very much. And it's been a pleasure to show some of the work that we've been so pleased to work with our partners at the European Environment Agency on this today.
Thank you so much for sharing your findings and providing overview of these indicators. And also I have to say, I especially appreciate it in the end for making the link also with the recovery from COVID, as it is now, if ever, that we can get our actions right. And we need to think very carefully how we aim to recover from the crisis where we are. And it's very, very helpful to hear your thoughts on that. I know you'll need to leave, but we're very grateful that we have your colleague in the panel to answer any questions there may be on your work. And so thank you so much, Ian Hamilton, for joining us today and sharing your findings and the work. And we'll move on to our next speaker.
Thank you, Annika.
Thank you, Ian. Thanks, bye. And we'll move on to our next speaker, Carlo Buontempo, who is Director of Copernicus Climate Change Service. And we'll be delighted to hear from you. What is the connection between the Copernicus Climate Change Service and the Observatory? And how can Copernicus support the Observatory? Thank you very much. The floor is yours.
Thank you, Annika. Thank you very much. And good afternoon, everyone. It's a real pleasure to be on this panel with you this afternoon. So to respond to your question in a few words, I could say that Copernicus in general and the Climate Change Service in particular operationally provide good quality data that is free and open climate data, and this information is fed to the Observatory. But going back to the discussion we were having a few minutes ago, is not just about having access to data, it's also having tools to help making sense of such data. And that's exactly what we are doing. So let me just do a step back from this and look a bit in the perspective. This year has been the year of the global pandemic, and the focus is inevitably on COVID. But this has not been the only extraordinary event of the last 12 months. We had an incredibly warm year. We had a year characterized by an unusually intense tropical cyclone season in the North Atlantic, by heat wave in the Arctic and temperature extremes and drought, and so on and so forth. So we need to have tools to analyze all these changes and the impact these have. So climate is becoming an important new element that we need to grapple with in all our decisions, health being a crucial one here. So there are some links, some rather direct links between climate and health, and we heard some of them earlier today. The link with heat waves is particularly striking and is only exacerbated by the urban heat islands, for instance. But there are other and at times less obvious linkages. So if you look at the Arctic, and these last few months have been quite unusual in terms of the Arctic, the de-icing, the melting of the ice actually opened the opportunity to new old pathogen to become available. If you look at vectors, vector-borne diseases, so the spread of ticks or mosquitoes and the diseases that they bring, these are all examples of direct linkages or indirect linkages between climate and health. And to understand, analyze, and respond to these emerging challenges, we need good and reliable data. So operationalizing climate data and service provision is one of the challenges of our time, I think. And the Observatory is really capitalizing on the work that has been done in the Copernicus program by C3S and by the other services in the last few years. So the tools that we have to transform the petabytes or tens of petabytes of climate data into few kilobytes of crucial information, such as health indices that can be used to design policies. And more importantly, develop a mechanism where these indicators, these indices are not static and sit on a shelf, but actually are regenerated on the fly as soon as new data becomes available. And it's not just about the future climate that matters, it's also the climate of today. And so we need to cope with the climate that we have now, and we have seen the impact recently of the pandemic also on the environment, the dramatic reduction at times of atmospheric pollution within our cities induced by the pandemic. And once more, the Copernicus program through the atmospheric monitoring service provide information about particulate matter, PM10, PM2.5, NO2, ozone, UV, and so on. And these have crucial information for the observatory. So just to conclude, the Copernicus Climate Change Service and the CAM service work already very closely with the EA and with the Climate Adapt portal through an initiative called the European Climate Data Explorer. And this solid relationship that exists really provide the basis on which we have built the climate data connection for the observatory. Thank you.
Thank you so much. And I'm sure that we will have questions from the audience that we'll come back to you with in the Q&A. But as our next speaker, we have Jan Semenza, head of the Health Determinants program at the European Centre for Disease Prevention and Control. And it would be interesting to hear from you if you think that the emergence and spread of new infectious diseases gets enough attention, and how do you think the observatory could help in this regard? Thank you. The floor is yours.
Thanks, Annika. Yeah, that's a good question, particularly in the current times of COVID. We ask ourselves if it gets enough attention. But so it turns out that at ECDC, at the European Centers for Disease Prevention and Control, we have a big team that dedicates a lot of time to epidemic intelligence. And so what they're doing here, they're looking at events, health events that they're trying to pick up through crawling the web with search engines and confidential databases to see if there are potential health threats that are looming in the horizon somewhere far away that could potentially be a threat to Europe. And so they basically look at all these epidemic events worldwide to assess if there's a threat to Europe, and then trying to see what kind of steps can be taken. So it's a systematic way to go about this by looking at all these events that happen worldwide. And the question that you raise is an important one, because do we have a handle on what's going on worldwide, and what can we do about it? And so we are trying to answer that question by trying to understand what are the underlying drivers, determinants, or risk factors, what leads to these type of epidemic events worldwide? Can we understand what precipitates an epidemic in Europe? And so we basically looked at all this epidemic intelligence data that's collected at ECDC and analyzed every single event individually, and trying to tease out all the underlying drivers and determinants for every single event. And we tried to pool all those drivers into three different categories: global environmental change being one of them, health system as another one, and then demographic change and lifestyle changes. And we recognize that the biggest drivers for these type of epidemic events in Europe is in fact global environmental change. So that's the biggest driver for these epidemic events in Europe. And when we tease that out even more, we see that travel and tourism is the single most important driver of epidemic events in Europe, but climate is in the top 5. And so the question is, what can we do about that to protect the health from the public? As we had discussed earlier, prevention is the best strategy. And so we have come up with a number of strategies to tackle those underlying drivers directly, as opposed to trying to fix the problem when it's too late. And so we have built early warning systems where we monitor, for example, travel and tourism, so passenger volume that comes in from endemic areas that could potentially bring tropical diseases to Europe. So we can set up surveillance systems in those travel hubs where people arrive from tropical areas to make sure that no diseases are imported into these areas. while the climatic conditions are suitable at the destination where these people arrive. We have also looked at water conditions and sea surface temperature as an early indication for waterborne diseases. And the Vibrio tool that was mentioned earlier is an example like that, where we monitor with satellites the sea surface temperature and salinity to indicate which waters and bays and beaches in Europe are at increased risk for these bacterial infections that can potentially be fatal. So we can go in with beach closures and other strategies to minimize that exposure. So your question is a good one. We at the European CDC, we do a lot of work on epidemic intelligence, trying to capture those events, but also trying to address the underlying drivers and determinants of these events so we can have an impact on those epidemics before they have dramatic consequences as the COVID-19 pandemic has shown.
Excellent. Thank you so much. And it's great to see this work going on and the raising of the knowledge that is already taking place. I'm happy to come back to this during the Q&A as well. As our next speaker, we have Angelo Maggiore, Scientific Officer at the European Food Safety Authority. We'll be especially interested to hear from you. How can the Observatory support your work and member states in addressing food safety concerns? Thank you. The floor is yours.
Thank you very much, Annika, for your question, and thank you very much for inviting me this afternoon with you. I would say that most of the time, when thinking about the effects of climate change on the food system, we think about effects on farming, on food security, addressing therefore the question of food production for a growing human population. However, future challenges for food safety and nutritional quality, which are also important health determinants, are not usually investigated in depth. So I see three possible interconnected ways the Observatory can support EFSA, the European Food Safety Authority. The first one is the Observatory can support the process of identification of emerging risks for food safety driven by climate change. And this will contribute to preparedness, to risk assessment and food safety challenges. And when I talk about preparedness, what I mean is being able to anticipate also in the long term, but also possibly prevent. We have heard about prevention in previous interventions, prevent future risks. In particular, the Observatory could provide information on new hazards or changes in exposure or susceptibility to known hazards, changes in composition of food items, and also interactions with other drivers of change like policy, social, economic, and environmental drivers. Secondly, I think the Observatory could foster participatory processes within what we call an ecosystem of expert networks, engagement, knowledge sharing, win-win partnerships, and co-creation. And these are the tools to handle a problem which belongs to the realm of what's called post-normal science, which is that kind of science characterized by high complexity, high uncertainty, and high number of stakeholders as well. And these are the tools which allow us to find patterns and make sense of the large amount of weak information. So it's a large amount of information, but it's quite weak, so not underpinned by a robust evidence base. In the era of the big data and infodemics, I would say. And these are also the tools contributing to the establishment of a One Health approach. So that kind of approach bringing together environment, human, and animal health, which is so much needed, particularly in these days. A third possible way the Observatory could support us is related to the fact that it's not only about the effect of climate change on the food system, it's also the other way around. We know that the food sector significantly contributes to greenhouse gases emissions. Therefore, I think the observatory could also contribute to the reflections on food chain sustainability and the two-way interaction between climate change and agricultural practices. Thank you.
Thank you so much for these reflections. I would be happy to come back to this because, as you well mentioned, I think that many people have not yet fully understood these linkages between climate, health, food safety, and that certainly would benefit from further reflections. As our next speaker, we have Alice Chapman-Hatchett, President for European Public Health Alliance. And we'll be delighted to hear from you as hopefully a future user of the observatory. How do you see the value of the observatory for organizations, NGOs like European Public Health Alliance? And what role could it play in improving public knowledge as well as local level action? Thank you very much. The floor is yours.
Thank you, Annika, for the introductions and the questions. Can you see my video?
Yes.
Thank you.
I can see you.
Thank you. I wasn't sure. So thank you very much for the introduction and your questions and the opportunity to speak today. And good afternoon, everybody. So in order to answer the first one, what's the value of the observatory for NGOs like ourselves, IFA? There's obviously a very clear scientific consensus on the negative impact of the climate crisis on health. And yet the general public is not always aware of this. We need clear and impartial evidence to understand the new challenges caused by the climate emergency on our health. And we feel very much that the observatory will be a new provider of valuable data, and not only just the data aspect of it, but the fact that it's going to create useful connections between researchers, NGOs like ourselves, and decision makers. It's absolutely crucial, in our opinion, to base the decisions on our health on the latest scientific evidence. And we're really glad that the observatory has expert partners such as the Lancet Countdown and WHO Europe. In terms of what role we think it could play in improving public knowledge and looking more broadly our hopes and expectations for it, I noticed that the observatory is intending to publish an annual report on climate crisis and health in Europe. And these reports and data collection are absolutely crucial for our work. So to give you a concrete example, thanks to European Environment Agency data, we were able to analyse and compare the health costs of air pollution in 432 European cities and the linkage with transport. On average, we found that every inhabitant of a European city suffered a welfare loss of over €1,250 a year, owing to direct and indirect health losses associated with poor health quality. So we feel very strongly that there is going to be a strong role for the observatory there. Tackling health inequalities is one of our main objectives. We know that air pollution affects the most vulnerable and the hardest. With more data, more precise resources, we will be better able to identify the areas where pollution is higher and thus act to improve the health of the communities who live there, which are often members of vulnerable or marginalised groups. And finally, what role do we think it could play in improving local level action? Looking more into the future, what do we think it could do, our external perspective of it, and how we would want to use it? As I've mentioned just now, we're very much hoping that it's going to give us more precise, useful data at the very local level. This would then enable us to refine our analysis and improve our recommendations for the benefits of local communities. Thanks to EEA data, we've also noticed huge discrepancies between member states on how air quality is monitored. With more local level data, remote sensors, we would be able to identify these discrepancies and tackle them earlier, and overall help contribute to our aim of reducing health inequalities. Thank you.
you so much. And it's great to see how you see already the value, and you also help to answer some of the questions I've seen coming in the Q&A about the value for local actors. And maybe that's an area we can come back to also during the Q&A. Before we open the floor for questions from the audience and start responding to the other questions you posed, I would like to come to Marina Romanello, the data scientist with Lancet Countdown. So we heard earlier already from Ian Hamilton about your work on the linkages. We've heard about the potential of the observatory for different users. We've heard about the importance of data, and your work at the Lancet Countdown on indicators certainly helps to understand what's at stake, as well as what are the ongoing developments with health and climate. But going forward, how could data and indicators be further improved to better understand the linkages between climate and health? Thank you very much. The floor is yours.
Thank you, Annika, and thank you, everyone. It's such an honor to be here with this great panel and seeing these great presentations and being part of this, the launch of this observatory more than anything. So thank you very much for having me. And that's a great question. At the Lancet Countdown, we do a lot of work, as you probably know, on developing indicators for tracking the interrelationship between climate change and health. And I think when we develop indicators, it's really important to keep in mind what it is that we're trying to do, and then to see how we can improve it. And we heard today about the risks that climate change poses in Europe, both current risks and emerging risks in terms of exposure to extreme weather events, to vector-borne diseases. And I think when we think about the EU and this observatory, what we really want to do is to be able to monitor these existing and emerging risks and what they mean for health in Europe, to be able to inform adaptation and mitigation strategies that will protect and minimize health risks. And that's really important to take into account. So in doing that, we have two sides of what type of indicators we want to be producing. One of them has to do with developing modeling and early warning systems, trying to see what are the emerging risks and start to prepare to cope with them to minimize future health impacts from emerging risks. And on the other hand, is to have a monitoring system to be able to live track how we're doing in terms of reducing those impacts. And that is absolutely crucial, because as we've seen today, there's a lot of policies available across Europe in terms of adaptation to climate change and mitigation of climate change. And being able to monitor and track their effectiveness needs these indicators to use live data and monitoring data from surveillance systems and bottom-up collected data. And it's important that we keep that in mind, because that will allow us to readjust and to tailor our response to actually have the biggest effect possible. And in doing that, obviously, for developing of indicators, you have to first have great models, understand what are your parameters, and be able to model these emerging risks using live inputs of environmental data, demographic, epidemiological data, to be able to track how these risks and future hazards are changing. And for existing impacts, to be able to collect health data that is so important and so hard to access oftentimes. And one of the key issues that we face when we're trying to develop indicators, both for the observatory as well as for our report, is being able to access that data, and more than anything, being able to access data that is standardized and homogeneous so that we can actually incorporate it and look across countries. Climate change does not respect borders. This has to be a cohesive response that we're giving, particularly for a place like Europe, where you have like such great authorities that enable that. So I would say that in order to improve the indicators, we first have to start collecting this data. We have to start generating standardized systems of reporting and monitoring of health impacts. And we have to start making this information available to the authorities across Europe, but also to the researchers that will then help us develop these models and help us improve how we're tracking these emerging risks. I was really excited to hear about HERA that was mentioned today. So I think that would be a great example of how we're starting to track and monitor for emerging infectious diseases as well. And then I think finally, as we have seen with the observatory, and we've been working very closely with the EA that is fantastic at this, being able to communicate that data in a way that is useful. Sometimes we develop the indicators, but they actually have to be translated to be useful and usable to the health authorities. And that requires very, very close collaboration, so that when we develop these indicators, we know that we are being able to communicate and making it usable on the needs of the health authorities and the policymakers across Europe, so they can actually incorporate this evidence when making their decisions. So I think that covers it. Thank you, Annika.
Thank you so much. And I'll immediately, because there's been, I see a lot of questions, and I would suggest that if all of the panelists, if you can turn on your videos, I hope the technology works with us. I'll be happy to take some questions from the audience. And as you may have seen as well, there are a number of them. But the one thing that keeps on coming up is the data, access to data. And Marina, as you said as well, the importance of standardized data. So I would just want to give you a chance, all of you, to respond, talk about this importance. And there's a question from Banakiotis and Shaslaridis also on this, starting with the comment that to be effective, newest data on climate change and its impact on health need to be accessible in lay language and targeted. And the question is that how can the Observatory ensure a timely dissemination of this data to the broader public, including vulnerable groups? Are there any synergies with civil society to be foreseen to enable this work? And I would just like to give you all a chance to respond to these questions around data access, standardized data. What in your mind do you think that really needs to happen now in order for us to be able to accelerate the collection and sharing of this data? And just want to give you all a chance to respond. Who would like to go first? Marina, maybe you want to go?
Yeah, I can, sure. That's a really great question, actually. And that's part of when I was talking about kind of having to collect real health data and monitoring bottom-up data from health system and actual health impacts. That's a key component to it. What we do in many cases now is try to model health impacts. We try knowing how, kind of from previous studies and from available evidence, we know how different factors are affecting health, and then we use that to generate models. But what that does not allow us to do is to identify how different groups are being affected and how different groups of inequalities, different perhaps marginalized groups that perhaps feel those impacts the most. We oftentimes do not have models that have that type of resolution. So in that, again, it's first important to identify what is the biggest problem. I think we're already a long way there, but then establishing systems that are standardized across Europe. Obviously, with data collection, you have a lot of issues of data protection and anonymizing data and security. So we have to have robust systems in place to anonymize data, to ensure that we're collecting it in a standardized way that serves the purpose, that we're collecting all the data that we need to make the best out of it. And that when we collect the data, for example, on the health impacts of extreme heat, that we're also incorporating data that tells us about what's the socioeconomical context of that person, what are the environmental conditions that person was in, so that we can start actually measuring these inequalities and these uneven impacts of climate change. Up until now, we're not being able to quantify it, which is desperate, because we know that the most disadvantaged are being affected the most vulnerable groups are the ones that will have the hardest impacts, and that climate change is an inequality amplifier. So it's really, really crucial that we start being able to monitor those inequalities, and that requires cooperation across countries to start collecting that data in a way that is secure and make it accessible, obviously.
And just to add what Marina just said, so ECDC has been working for many years with the Lancet Countdown to trying to link this health data with environmental climatic data. So from our perspective, from the European CDC perspective, we have a mandate to collect infectious diseases throughout Europe. In fact, 50 or so infectious diseases are reportable by law in Europe, and they have to be reported to ECDC. And the researchers can request these type of data, and you know, it's basically a standard procedure to apply for these type of data sets that then can be linked with type of indicators that we are trying to develop at the Lancet Countdown to see what is the relationship between the incidence of these diseases and these climatic indicators, and see how they're all linked. And so the advantage with the ECDC data is that they're clearly defined with a case definition that's standardized throughout Europe, and all EU member states report those to ECDC. It's a great resource that's available to researchers. But not only that, we also collect vector data. So if you think about invasive mosquitoes like the Asian tiger mosquito that Ian mentioned earlier, the Aedes albopictus, there's a system in collaboration with EFSA to collect those mosquitoes throughout Europe and see how they spread throughout different areas in Europe in relationship to climate. But we also look at ticks and other vectors that are important for health. So there are lots of data sets that are available, and the observatory now is a great platform to connect those dots, the health data and those environmental climatic data, and try to make sense of where we are in the trajectory of climate change, as Marina mentioned earlier.
And Annika, do you mind if I step in here?
Absolutely.
So,
feel free.
I would like actually to follow on what Jan was saying, in that there is some good news here. There's been a big investment on standardizing data, and on the weather and climate side, actually all this data is available, is open, is free, and is standard. So if you want to know, for instance, the temperature in any place in Europe for the last 50 years, well, you can now know it. You can go on the website, you can use an API to retrieve the data, and the data is available, and the quality of this data is controlled. So within the weather community, within the climate community, also thanks to initiatives such as Copernicus, actually there has been a lot that has already happened. And while there is always more that we can do. There is more standardization, there is more interface, especially to non-climatic data. So we're talking about vulnerability and exposure. These data often are not so standardized and more difficult to get. So there is work that can be done, and some of this work will be done as part of the observatory. But I think there is also a positive message that can be sent out, and the fact that we start from a very good condition. Europe is in a good condition. A lot of this data is available, and is available about the past, is available about the present, the near future, the next 6 months, what's going to happen, and the long-term future for Europe. So please use this data, and the observatory is a great user already of this data, and many more can take advantage of this large investment.
If I can come in here, Annika, picking up on the civil society organisation aspect of the question, and picking up also on what Marina said previously. Yes, obviously the data is important, but if we can't communicate the data, it's almost not worth having the data in the first place. And I think the way we see the observatory is not only how can we benefit from you, but equally how can you benefit from us? And I think there we really can be of huge help, because not only in providing you access to marginalised groups, because that's a lot of the world that we operate in, but also in terms of this translation of the language, of the data into language that the layperson can understand, that vulnerable groups can relate to. I think that is where we can really provide added value for you, and we'd be absolutely delighted to continue a relationship along those lines with you.
Excellent. Thank you very much.
Yeah,
we have so many questions. Sorry, Angelo. Yes, you wanted to jump in as well?
Yeah, maybe just to expand a little bit with my thought about data, which is a very, very crucial point also from the perspective of emerging risks and preparedness, in particular long-term anticipation. What I think is that a possible way to achieve or to contribute to that is to expand as much as possible the sources of data, even reaching out to citizens and social media and these kind of sources. The problem with that we are struggling for quite some time now is that we then have a huge amount, a large flow of data, but these data are quite weak. They are kind of weak signals. And that's why we say that we live in a data poor environment, and that's the typical problem for preparedness and for anticipation. But that's why, in my opinion, it's very important to gather experts together, and the observatory can absolutely contribute to that in order to extract knowledge out of this vast and incomplete amount of information, the so-called making sense, as I've heard in previous intervention. So I think that's also another important contribution regarding data. Thanks.
Thank you very much. I would like to take a question, and it relates to the COVID-19 pandemic, and inspired by the comment or the question from Professor Dr. Maria Jevtic from Novi Sad and European Public Health Association. She's asking whether the COVID-19 pandemic is slowing down global climate change adaptation and mitigation action. But I would just like to turn it around a bit and just add a dimension into this as well. That would be interesting to hear from you how you see climate change is or may be impacting the spread of pandemics. And indeed, it's very interesting. Climate change is also affecting our fight against COVID. And we already did hear about, from Mr. Bruyninckx, we heard about the causes for pandemics and discussion around ecosystem restoration as one option to avoid future pandemics. So any thoughts you may have on that would be very interesting.
I can take a quick stab at it. So basically, the changes we have seen are short-term, right? So we have seen a dramatic decrease in greenhouse gas emissions as a result of the decrease in air traffic, transportation, and industrial output and all that, which has been very welcome and given nature. However, it's picking up very quickly again. And so we need to think more structurally and try to go about this in a more systematic way instead of having these short-term fixes, because it's basically not going to do the trick. And building back better is the strategy for the future, trying to learn from past mistakes and try to see how we can improve the system. So I think there are opportunities here right now. It's a more short-term effect, and it won't have the kind of desired long-term consequences that we would need. But if you think about the city of Milan, during the lockdown in Milan, they were able to see the Alps for the first time in decades, because air pollution had obscured their fantastic view of the white mountain chains in the background. And then suddenly they gained an appreciation for that incredible view. And as a result of that, they have implemented policy strategies to retain the kind of lockdown situation by locking out traffic, at least from the inner city, and making sure that they build bike lanes and public transportation to reduce the mobile source emissions, and trying to retain that kind of scenery that the city naturally has. So I think there are benefits to COVID when it comes to environment that can be translated into more longer term policy strategies to improve the health of the public, but also the environment.
So maybe I can chip in again, just to say that the pandemic has indeed had an impact on the global emission of greenhouse gases, but it was a small one, and the emission remained positive. So in a sense, we keep adding greenhouse gases to the atmosphere. And from a climate point of view, if you're serious about the Paris Agreement, we would need a pandemic every year for the next 20 years, roughly, in terms of order of magnitude. So just to put things into perspective. So this can be seen as a very negative, or it can be seen as a positive. So like 2 years ago, we would have thought that a reduction of this amount in a year was just impossible. And the pandemic allows or forces us to think that actually is possible. And while the initial step is always easier than any step that follows, the fact that we achieved that at great cost, allegedly, but we achieved that gives us some hope that we can follow on that path, and we can see a path towards a significant reduction in global emission. I was also keen to make a comment, because yes, there is this this element of the impact on pollution in cities that's been very remarkable, especially the pollution associated with transport. So particulate matter and NO2 in particular were very significantly reduced. But there were some confounding factors. So the change in atmospheric circulation in some cases also played a role. And this again points back on the importance of the observatory, of ensuring that all the data is accounted for, the one that fits the overall narrative and the one that doesn't, because we really need to be serious about that if we want to use this data to inform policy. So again, I think there is a general call from all the panelists today to really increase the use of the data and information this can give to policies.
Annika, if I can come in around how we actually view COVID at the moment. So we're talking about COVID as a pandemic, but actually I'd argue quite strongly that that's the wrong word. It's a syndemic. So a combination of many different diseases, many different things all coming together at the same time, giving rise to a very unique situation. And at IFA, we very much see climate change as being part and parcel of that. So we know the impact of air pollution, but we're also beginning to see through the data where you map across where the deaths from COVID are arising, and then you map across the air quality, again, you get a correlation. So I think it is absolutely vital, if we've learned anything from COVID, it's the fact that we have to look at health and environment completely holistically. We cannot put them into boxes, and this is why we're so keen that the observatory has been established and what it's going to be doing. We have to work at these things together, and in the same way, it's not just a case of scientists, doctors, it's across the piece, across the professional piece as well. We have to approach this together, because otherwise we're not going to improve outcomes.
Thank you very much for making this. Yes.
For another comment, Marina, do you want to move on to the next question?
No, Marina, please feel free to jump in.
Yeah, there you go. I just wanted to, I absolutely agree. I think we're kind of thankfully all on the same lines. But I perhaps just wanted to note that this has happened before with another global crisis that was not in the same magnitude, but in the 2008-9 economic crisis, we saw a reduction in emissions. And that was probably followed by a big spike in emissions, and they have been rising ever since. So now that we're kind of perhaps starting to get out, or at least seeing how we will reactivate from the COVID pandemic, which is not over yet by no means, but starting to kind of find our way out, it's really important to keep that in mind and understand that today we have tools that have been accelerated by the pandemic that we can start implementing. We're in a level of technology that allows us to replace fossil fuel burnings by clean energy sources, and that the pandemic has taught us a lot of questions in a very traumatizing way, and perhaps for all the wrong reasons. But it's important that we have the kind of the openness to understand what are the benefits that we can take from the transition to a healthier lifestyle, even if it was implemented perhaps in all the wrong ways. And I think one of the main things that the pandemic has shown us is how vulnerable our health systems can actually be in the face of big health impacts in a way that we didn't expect it. We thought that we had the high HR regulation from the WHO scoring really high in some countries, and still we couldn't cope with this pandemic. So taking this as a lesson to build back better, both in terms of mitigation and adaptation in our health systems, strengthening and finding again the value in our health systems that will have to face new and emerging risks and multi-hit scenarios from extreme weather events, emerging diseases, food impacts. So climate change will make things a bit worse in the coming years. So we have to really strengthen our health systems to cope with that. And strengthening from COVID can help also drive us in the right direction if we keep our focus on building back healthier and better.
Very good. Thank you so much. I actually would like to just pick on that. We've heard a number of times this phrase, building back better. And while I think that in our discussion, we're very much focused on people and the health risks to people, I think that something that it's worthwhile to bring into this discussion is also the vulnerabilities in the infrastructure itself. If hospitals, healthcare centers aren't equipped against floods and heat waves, or there can be shortages in water or energy supply, this could have devastating impacts on their functioning at times of crisis. So we'll be happy to hear your thoughts on how can we better prepare our infrastructures, and how can the observatory help also governments, public healthcare systems, to make sure that they really are equipped against these, what we know are inevitable crises of the future. I also would like to group and add a few other questions here, because there are so many, and I'll be happy to try to find ways how we can respond to these. We've had several questions about mental health effects, and we'll be happy to hear your thoughts on that. Could you elaborate more on these risks, as well as how could the observatory help to address related challenges? We had a specific question from Agnieszka Olszewska-Gizo, I hope I pronounced your name right, on the impacts that depleted urban ecosystems have on people's mental health, and the fact that there is less of a contact with nature, how that impacts people's mental health. And so any considerations how you think that the observatory could recognize this as an issue? And I'll bring in one more question in here. Question from Paul Forte is about the boundary between healthcare and social care, and how that is blurred, especially when we're talking about older people. And if we are to maximize health outcomes and maximize efficient use of resources, usually we need to address both of these dimensions, health as well as social care. So how does this social care fit into the observatory remit thinking, or how should it fit into the observatory's thinking? Who would like to go first?
So if you want, I can make a comment in relation to the
Sure.
build back better, because this is a topic that goes way beyond health as such. And I think is one of the big challenges of our society these days. So the society and the way in which we deal with risk in generally has been built around the assumption that the past was a good proxy for what was going to come. So the 1 in 100 years return period flood, right? You look back, you see how many times has occurred, and then this gives you an estimate of how likely this is to happen. And this is only works as an approach if the climate is stationary. And we know that the climate is no longer stationary, partly because of climate change, and partly because we are actually have now tools to monitor and predict part of the climate variability. So I guess part of that means relying more heavily on good quality data on what's going to come. So this means that the building codes, the procedure, basically everything in our society needs to be based on a combination of historical data and expectation or projection of what is going to come.
I can take a stab at the social services question. So in 1995, there was a big heat wave in Chicago. And at the time, I worked for the Centers for Disease Control in Atlanta, and I led the response at the time. And the one thing that we found during that heat wave was that socially isolated individuals were the ones that had the increased risk for heat-related mortality. So we went out to this big case control study, and we found out these risk factors, and we found these isolated individuals to be at increased risk. And so when we designed these health action plans, we recognized that this was the most important thing, to set up phone banks of vulnerable populations so you can specifically target those individuals that suffer from social isolation. And then during a heat wave that you can anticipate with the work that Carlo is doing with early warning systems 5 days in advance, you can predict a heat wave, you activate that phone bank, you get in touch with those individuals. And this is the crux. Public health has to work in conjunction with social services and people that are embedded in society, nonprofit organizations and all that, and reach out to these individuals to make sure that they have contact with other human beings, that they are taken care of when it comes to water intake and exertion and air conditioning and all the things that are needed to protect their health from these heat waves. So ultimately, public health needs to break out of the pigeonhole It needs to be connecting with the civil society, with other groups and other social services in order to have an impact. And these early warning systems need to be designed along those lines. It's a crucial new development that we need to adapt under these pandemic situations even more so, particularly now coming up in the future with climate change.
And I can come in and try and tackle some of the mental health aspects.
Come in. Oh,
Annika, if that's okay.
Absolutely, thank you.
Yes, absolutely right. We've known for many years the impact of green space on mental health, on positive mental health. And we've known equally for many years the impact of an urban grey landscape on mental health. And I think one of the things that we have seen, particularly in COVID, is a broader realization of both of those truths. The fact that people's mental health has been terribly impacted by COVID across the board, but it has been really even worse than that for a nurse living in a high-rise apartment block in a city centre who is struggling with her own mental health at work, but then is also struggling because of the environment that she finds herself living in. And I think it's something that, as I say, a lot of research has been done on this, but it's something that largely has been paid lip service to over the course of planning developments, and it hasn't really had that prominence that the research has shown it ought to have. So I would hope that one of the things that the observatory would be able to do is to raise that voice, to really give it a bigger platform to speak from, to connect the data in that sort of linear way that I've described, to really show that this is important, that we need to be tackling it. And you know, the fact that governments across the EU during the various lockdowns we've all been in have said, oh yes, you're allowed to leave your house for the purpose of exercise. You know, there's a recognition there. It was one of the only things we were allowed to do: food, medicines, school when you can, and exercise. So, you know, if those are the four most important things that make us human, well then let's give that fourth one, that green space, the recognition that it deserves.
Annika, if I can jump in on that note as well, and absolutely agree. There has been a lot of talk lately about green prescribing and social prescribing as a fundamental aspect of healthcare that I think we're starting to accept, and traditional health is also starting to incorporate these notions, which is absolutely fantastic. And with respect to kind of the social determinants of health, there's very good evidence, very robust evidence, much of it from Europe actually, from EU-funded Horizon 2020 studies, the Life Path Consortium, that have shown that the social determinants of health contribute to health as much as the traditionally accepted determinants of health as kind of exercise, air pollution, exposure, and other very well-established risk factors. So it's absolutely crucial that we start acknowledging them, because we want to improve health, and we want to also reduce demands on health systems. We want to reduce the pressure on health systems and the use of resources by healthcare, which also contributes to the climate crisis, I should say. So we want to reduce that pressure on health systems. It's really important that we start incorporating these new ways of providing care and improving health. And with respect to mental health, it's one of the things that we get asked over and over again at the Lancet Countdown. So it's funny that it came up here too. But whenever we think about mental health, or at least my perception in terms of our indicators, Europe is one of our jewels for these type of indicators, because here you do have health systems that incorporate mental health. We do have a good recognition of what mental health is. And it varies from place to place, but if there's one place in which we can start actually addressing and monitoring mental health impacts through indicators, probably Europe is the right place to do it. So I'm really glad that this came up in this conversation too. It's a very, very tricky aspect, but it's one of the biggest health impacts of climate change, both through eco-anxiety and through the known impacts of, for example, extreme heat or extreme weather events on our mental health. So hopefully we'll be able to address a few indicators around mental health as well. The WHO has done fantastic work as well in terms of assessing the capacity of health systems to address mental health and to which extent mental health care is being provided. So that hopefully will help clear up that aspect of it.
And I would also say that there is an impact of mental health or welfare, with the way we want to call it, with food, with what we eat, how much we eat, no? This kind of things. So that also needs to be recognized, I would say.
Very good. Thank you very much. I'm starting to recognize that we are starting to run out of time and we'll have to wrap up shortly. There were a lot of questions being posed also about the future of the observatory, what it can do for different areas. And just to let our audience know, all of these questions will be shared with the European Commission, with the European Environment Agency. We'll be sharing them also with our speakers so that we'll give them a chance to come back to you. And as there were so many areas, I think that would have been wonderful to continue the discussion, but unfortunately, their time is a limit here. But I just want to say that this has been a wonderful exchange, extremely rich discussion, and it has certainly shown and reminded us of these interlinkages, the importance for this holistic approach, the importance of understanding that this is not just for Europe, this is a global issue, but in Europe we can do a lot to understand these linkages, also for the fact that there is already a lot of data available, including, as was just discussed now, on mental health. So this gives us a great opportunity to build on already available data, enhance our knowledge on understanding the linkages between climate change and health. And with the European Climate and Health Observatory now in place, there is a place where we can bring together the work and the expertise and try to improve the knowledge base, which is also extremely important for better informed EU policymaking. I would like to thank the European Commission and the European Environment Agency for the cooperation in organizing today's discussion. And I would like to thank for our wonderful speakers, both in the first session as well as in our second session, for sharing your expertise, sharing your knowledge, and recognizing a lot of the, on one hand, the challenges, but also the possibilities if we are able to understand these linkages better. For our audience, I would like to thank you for your very active participation. And if you haven't yet done so, please do check the observatory site to see it for yourself. And with this launch, we hope that it will serve and benefit many of you in the future. So thank you very much for joining the discussion today, and wishing the observatory the best of luck, and wishing the partners and the initiators for the observatory all the best in taking it forward and making it as valuable and beneficial for the future users as possible. Thank you very much for joining the discussion, and we look forward catching up, hopefully on the observatory in the future, to see where it has gone, and maybe also continuing discussion on how it can be used outside the EU borders. Just a thought. But thank you very much, and wishing you all a very good afternoon and a great rest of the week. Thank you. Bye.
Thank you. Goodbye.
Thank you. Bye.